In part 2 of this conversation, Debunking Sleep Myths, we go deeper into more critical aspects. If you missed part 1 of this conversation, take a listen to episode number 144. In today's podcast, we will answer 3 questions. Is napping good, bad, or essential? Is snoring harmless or harmful? Are over-the-counter sleep medications safe long-term? We also look at what can postpartum women do. Dr. Shweta Kanchan was very clear that she wanted to set out to debunk some of the common sleep myths out there. This 2-part episode explores very common statements that you might hear. Dr. Kanchan is a sleep specialist who got fascinated with sleep medicine and carried out postdoctoral research work at King George's Medical College. She has several publications in various national and international journals, and her work on sleep during COVID-19 pandemic was published in the prestigious Journal of Clinical Sleep Medicine. She is certified by the prestigious World Sleep Society and also holds the RPSGT credentials, which is a gold standard certification of sleep technology. Let's get started. Hey everyone, I'm Deepa, Light Functional Medicine practitioner, author and yogini, and you're listening to the Sleep Whisperer podcast, the only sleep podcast with conversations and meditations. I'm on a mission to share profoundly insightful sleep conversations with global visionaries that merge together functional medicine and ancient wisdom. Breathe in bliss through weekly guided meditations and let yourself enter the land of dreams. Together, let's unravel the pieces, get to the roots, and understand the right tools to transform your sleep completely. Through this podcast, I want you to dream the best version of yourself. It's time to regain hope and begin your sleep journey. Now, coming back to something that is a bit controversial, because you hear Rujuta Devekar telling every day on her Instagram about how everybody should take a nap after sleep. And Ayurveda is always about saying that the nap during the day is one of the ways that you have circadian misalignment. Now, we hear a lot of things about napping. I do come across sleep practitioners in the West who talk about how to take a nap the right way, what is the time to take a nap, and or even the statement that a nap can compensate for not sleeping at night. Now, is that a myth or a fact? And also, what are your thoughts about napping itself?
Several very, very important and relevant issue they touched by you. So, first of all, napping is not essential. So, again, it's a myth that you need to nap every afternoon or every day, in the day hours. It is not essential. It is just something. It's as simple as that. See, sleep is a physiological need. So, that is an essential part. Napping is, some people take a short sleep in the day hours, and that is what napping is. So, it is not essential. And nap actually little bit lessens the sleep depth that you have. If supposing you have been waking up from 6 in the morning and you go to sleep at 10 in the night, so maybe some people go and take a nap of maybe 30 minutes, 40 minutes around 1 p.m. and then they say that I'm feeling better and I'll be good throughout the day. So that kind of short nap, that kind of nap early in the part of the day is fine. If you need it, it's fine. Because then that is going to improve your cognitive abilities, improve your memory, improve your psychomotor functioning, your vigilance. That is okay. But nap. But if you go on taking that nap like a sleep is, you sleep at 1, you sleep at 2, you sleep at 3, and you wake up after 2 hours of nap. So that is just destroying your good nocturnal sleep. It will prevent a good consolidated sleep from happening. It will do more harm than good, much more harm than good. So napping is not essential. If you don't need a nap, don't go for it. It is not something you need to go for it. It's just like if you don't need to eat a sweet, you don't eat it. It's not essential for your health. However, if you're taking one and in a limited amount, and in that part of the day where it can be easily metabolized, like supposing napping, if you're taking like around 1 p.m., 2 p.m., good, but don't go beyond that. I always ask my patient, so they ask me, what about afternoon sleep? So I said, if you want to have a nap, take it in the early part of the day. Say, don't go beyond 3 p.m. Then let it be a 30, 40 minute nap. That's it. That is enough to again give you, put you in the top gear if you need to, if you feel that you're feeling low or very drowsy. However, if you can go without a nap, that's still better. The reason being that we collect, a lot of metabolites as a result of a day-long working, like adenosine, like neuronal peptidases. These metabolites are a result of our homeostatic work or a physical activity or a mental work that we put throughout the day. Okay. And when these metabolites collect, at the end, they go and get attached to the preoptic nuclei where the sleep switches, that is the ventrolateral preoptic nuclei in the brain. They get attached, adenosine is attached there, and that is an important part of induction of sleep. So the more the homeostatic, the better the sleep. And we are decreasing the homeostatic drive by taking inappropriate, erratic, here and there naps. So what I mean to say is that napping is not bad if it is timed early in the day and it's a short duration of time, because if it is that way, it's good. However, if you don't take a nap, it means that you're getting more and more of homeostatic drive, because there are two things which push you to sleep. One is your circadian drive, that is in the night you sleep, in the day you wake, and the other is your homeostatic drive, that is the more tired you are, the more you work, the more effective you spend your day, the better the sleep will be. So those kind of metabolites, when they get collected in the brain, they put you to sleep. So napping kind of dissolves them a bit, so decreases the level of those metabolites. So if you don't need, don't nap. If you need, take a short and nap early part of the day. That's just it. It is not very important. You don't have to make a big deal about nap. That is what I feel about it.
And I think, Shweta, it's interesting that you compared snoring, napping to sugar, because that doesn't really make me feel very confident about napping itself. So it was an interesting analogy, connecting sweets.
That is just because, when I really have to press upon my patients. So there are many of them, especially young adults, they'll come from the college at 5 p.m. And they say, then after that, then I take a nap at 5. I said, why? Because it's like, then I can wake up till late in the night. I said, why do you have to take it? It's just like, is there a need for it at that time? It's better you stick to a fixed sleep schedule. You feel sleepy by 10. You go to bed at 10. You wake up at 5. That will be good. But then they are it's the kind of their behavior is what you call as behaviorally induced insufficient sleep. They are so much into, their thought is so much, or that they have disbeliefs about what a good sleep is, how much time, what is the nap, what is an ideal nap. So I have to keep giving them some kind of examples to enforce them. Maybe just came out of there. But otherwise, napping is not bad, but not advisable. If you don't need one, you don't have to go for it.
And Shweta, coming back to another myth, and this is something that, my husband and I used to joke a little bit about, because he has these terrible snores and I can't sleep next to him because the whole bed is shaking. And one joke that he made was, my father also snored, and that, I'm not paying anybody to snore. It's not harming. It's not costing me money to snore. But is snoring really harmless? Is that a myth, or is it really, it doesn't connect to more complex health challenges? What does it say about our overall health?
So I hope he definitely listens to this podcast of ours. And if not, this pass is to be really, you make him hear this. So what, snoring is, so there are two things with snoring. So when a person snores, more often than not, there has to be some kind of a pathology. So snoring could be harmless also. There are people who are primary snorers, whereby the snore is just because of some kind of obstruction in the upper airway and nothing more than that. And that's just a noise that is being produced by the vibrations. So the person needn't worry because of that. But more often than not, when a person is snoring, it is because of that obstruction is leading to something else. It is also causing, the person to have episodes of apnea, where he can actually stop breathing for some seconds. or hypoapnea, where the airflow will diminish or decrease to a certain extent. So these kinds of episodes of either apnea, that is cessation of breathing, or hypoapnea, what they see there, that, and also the person can have a dip in his oxygen level while he is having these episodes of respiratory disturbances. So they can be an indicator of a problem which is called sleep apnea, which could be an obstructive sleep apnea or a central sleep apnea. But when a person has sleep apnea, it means that throughout the night, because of these intermittent episodes of the hypoxia or intermittent episodes of decrease in airflow, he is having a lot of, the body is constantly in a state of stress. He is having the kind of air or the kind of the level of air we need to sustain the metabolic effort throughout the night. He's not getting it. He's not getting the proper amount of oxygen, the proper amount of that is all missing. So such people can then land up into a lot of metabolic derangements. They can have diabetes, they can have raised blood pressure, they can have stroke, they can have nth number of problems because of they're not getting adequate sleep at night, because sleep in OSA or sleep apnea patients is fragmented. Though they will not say that it was fragmented, but they have micro arousal. Or throughout the night, many times, whenever they have these obstructions, there'll be an arousal, there'll be a disturbance in the sleep study. We see that the patient is now in a state of wake. So the patient is not apparently awake, but the sleep study shows that the entire body physiology has gone into a state of wake, which means that the rejuvenating effects of sleep have just gone out for that duration of time. And again, the patient will go into sleep, then again a fragmentation, then again a fragmentation. So maybe if he's sleeping or snoring, say 40 times or 50 times or 100 times, every time that he snores, there is a disturbance in the sleep. So when you're sleeping that way, getting fragmented 100 or 200, 300 times in the night, will you be getting up refreshed, or will you be good throughout the day? And then it's going to land the person into so many metabolic problems later on. So it is something that if a person snores, it is very, very important. The person should consult a sleep specialist, should get a study done, a sleep study done. The sleep specialist will decide whether the level 1 study is needed with all the channels, or even the person can do with a home sleep study, which is, especially in the COVID times, it was preferred. The home sleep study with fewer channels, but that is also good enough for diagnosing sleep apnea. So please don't hesitate taking the person to a specialist who can then conduct a sleep study and who can diagnose whether the patient has apnea, or even some other sleep disorders can also be there, and then he can be managed accordingly. Snoring is not a sign of good health. That is one thing I'd always say. So when a person snores, he has to go to the doctor.
And I was just going to ask you to clarify that. So how does somebody know whether their snoring is harmless or not? So and you clarified that well for us. And coming back to usually what happens when people are struggling with sleep, and where do there are self-prescription of sleeping pills that's done, especially in India, because it is over the counter. And while this is a tricky area to navigate, I've spoken about this a few times on other episodes, but I think given that the gravity of the problem, that there are people whom I know personally who've been taking sleeping pills pretty regularly for close to a decade. So would you say that sleep disturbances, the inability to sleep or inability to stay asleep can be managed by sleeping pills or medication? And what is the safety? Is it safe for long-term usage? Are there differences and nuances between different classes of sleep medication? And what would your thoughts be upon that?
So this is something which is very important. You have touched a very, very important aspect, that is people randomly taking sleep medication, many times over the counter and many times over long durations of time, where they could easily have been managed by other means, but actually they had no, they were not aware that there were other means and methods to manage the sleep disturbances. And once they got into the habit of taking sleep pills, it became like a addiction for them, and they cannot sleep without taking those pills. That is a very common scenario in this present day time. What I have to say is that many a time, people, it has to be decided by the doctor whether the person needs a sleep medication and for how long, and what medication he or she needs. But besides the medication part, whenever a person has sleep disturbances, what the disturbance could be, either he cannot fall asleep for a very long time, he's in the bed, he's just waiting for sleep to come, or he has several awakenings in the night, or he wakes up too early in the morning. Then we have to carefully diagnose what the disorder the patient has. If the patient has a circadian rhythm disorder, like we were talking about the rhythms earlier, then the patient definitely doesn't need a sleeping pill. He's not going to bed till 3 a.m. or 4 a.m. It is because that his rhythm is delayed. He's having a delayed sleep wake pattern. So his rhythm needs to be reset. He doesn't need, if he's, yeah.
And I'm just going to stop you 1 second, Shweta, because the pertinent point, and this is something that I've noticed, and I'm sure that listeners need some clarification, that I have noticed somebody who, as you rightly pointed out, she watches very stimulating TV shows till 1 a.m. and then she says, I cannot fall asleep and I need sleeping pills. And this is what you tried to clarify just now. So do clarify that for us a little bit more.
So I think Deepa will just clarify this. I'll just clarify it with a few scenarios, what I have myself experienced while talking with my patients and other people. So there could be people who cannot go to, there are reasons why you fall asleep. Some people have poor sleep related habits that we call, they have inadequate sleep hygiene. Like somebody is taking 3 or 4 cups of coffee or tea after 5 p.m. in the evening, and he's saying, I don't get good sleep. I can't sleep till 2 a.m. in the night. So there we have the evidence that the stimulating agent is the coffee. Somebody is watching a lot of TV, or somebody is binge watching. The youngsters, they do a lot of binge watching, so they're hooked up to their mobile phones. Again, that could be a reason. One thing is because the content is stimulating their brains and not allowing it to sleep. The other reason is the blue light, which you were also talking about earlier, that is emanating. Again, that is also causing a delay in the phase shift, or the phase or the sleep phase is getting delayed. So a person who should ideally be sleeping at 10:30, because that delay is in the delay in the secretion of melatonin hormone. So that is being delayed, and now he cannot sleep before 2 a.m. So that is one thing. This is their phase or their circadian rhythm is getting disturbed. Another thing is that why do people, there could be so many reasons. The person is going for an evening walk, or post dinner time, they go for a very strenuous exercise schedule they go for gym at 8 p.m. So when this is happening, how do you expect a person to then go to bed at 10, because he has stimulated his body so much exercising? So again, we always say it's not preferable to exercise late in the night. That is sleep defeating. It's not good to go and watch television or stimulating TV. And if you have to watch TV, it should be, it's 1 hour before your bedtime. You just have to put a stop to it. It's also not good to have beverages or alcohol prior, close to your bedtime. That again is disturbing sleep. Then again, we talk about people don't have to be in dark, or in the light out curtains throughout the day and managing everything in artificial light. That also is not advisable. So if person is not able to sleep because of these bad habits or bad practices which are sleep defeating, which we say are the practices of inadequate sleep hygiene, then correcting these can correct sleep. They don't have to take medications as such at all. But unfortunately, they're not aware. They are so simple. Sleep hygiene practices are so simple, but they're not aware. They do it again and again and again till it becomes part and parcel of their life, and then they start taking a medication to top it up with, which doesn't help. Because whatever sleep they are getting because of that medication, it also comes with a price. It will come with maybe a price of lethargy the next day. It will come with a price of cognitive impairment, not functioning adequately to the best of your ability, mood swings, memory impairment, so many things. So until and unless a doctor feels that you really need a medication, so you don't have to take it, and then also you have your history, the kind of pattern, what is leading you to those behaviors, they have to be elaborated well, and we have to decipher why is this happening. Is it because of some sleep-related movement disorder or OSA, and the person is taking a sedative pill? That has to be very clearly defined, that this is the person has insomnia and he needs it for this much duration of time, along with some non-pharmacological therapies, and that has to be practiced in accordance with the direction of the trained sleep practitioner. Only then, over-the-counter use of sleep pills is never good.
And we did an entire episode on the dangers of sleeping pills with Dr. Nishi Bhopal. So if anyone wants to listen, they can go to that. I think, Shweta, I'd like us to go a little bit into phase of life. So, typically when some woman has had a baby, postpartum is a time, obviously, that there is some level of insomnia, mainly because it's default bad sleep practices. It's not because of choice, like we spoke about earlier, but if the baby is sleeping, waking, very restless, and the mother is just forced to be waking up at these times, it's not of her choice, but however, it's landed on her as default. And even sometimes when the baby is 6-8 months old, and then the baby is sleeping for several hours through the night, and then the mother is still not back to sleeping. And generally there's sometimes elders can tell you that postpartum insomnia is not something where anyone needs to intervene, that it will just settle by itself. And is that something that is true or not?
It's a very good question. And as female, we all have experienced this phase in our lives that whenever, female, when they go through the phase of having a child, and after the child is, and after that, it's so bad. The nights are so bad because mother, they sleep the sleep of their child, and the children, they sleep. So their sleeps are so disturbed because their rhythms are still not settled. So maybe a child he is going to wake up 5 times in the night and sleep throughout the day. And throughout the day, the mother has other things to attend to. Maybe she can't sleep the way the child is sleeping. So it's a lot of disturbance, and it creates a havoc on the body and the mind of the mother. So in the postpartum part, the postpartum period, this is one area which is not being touched much in the scientific researches. So I really, out of interest, I really digged up a lot of literature, and I found that much work has not been done in this regard. Though it is something which is very pertinent, and females, they do pass through it. So whatever I really found that women can be helped with cognitive behavior therapies, and also the circadian rhythm of the young one, the child, the newborn. They could be better entrained and timely entrained by means of exposing them to daylight or early morning light, or by means of giving them, like morning has to be like morning for the child also, that they can be timely entrained and timely, their rhythm can be in tune with the natural day and light cycle. So it will be a reliever to the mother as well. And Deepa, it's not just the females, it is in every age and in so many different phases of life that sleep disturbance have a role to play. Like especially one thing which I have been talking about for a very, very long time, it is in the case of the youth, the youngsters, which is the most productive population of the day. The young people, it's for mothers, it is not by choice, like you said. But for them, they have a choice. They can sleep on time. But it is just because of their behavior, because of their behaviorally induced insufficient sleep that they are taking, just because of the beliefs that they have, which I feel are disbeliefs, that's because of the attitude that they have towards sleeping, that it is not important. That's because of the fact that they keep procrastinating sleep. And it's fine to, they eat up into the sleeping hours to do so many other things. So I think for women, it's very important. And equally important it is that for the population which will be driving the nation tomorrow, the youth of the day, the youngsters, the adolescents, the point has to be synced into their mind that it is important for you to get good quantity and quality sleep in the night, so as you will have the benefits of it the next day and in the near future. And also in the long term, you won't develop metabolic syndromes, you won't develop so many diseases which otherwise you can have as a result of having a sleep debt for a very, very, very long time. So that is something which is very unfortunate, that young people are highly unaware of what sleep deprivation could lead to, and they are just eating into the sleeping hours. They sleep in the morning and they are good with it, but in the night time they have engaged themselves with so many other activities. This is again one thing which needs to be talked and discussed regarding sleep and its awareness.
And Shweta, when my grandmother and great grandmother were alive, and I remember that anyone in the family who had a baby, it was a done thing that the baby would be taken out into the early morning sunlight for about half an hour. And maybe we just thought there was no science to it, but obviously, when you're talking about how we need to try and drive the circadian rhythm of the baby through exposure to light, and that's what we're really talking about. Sometimes I think some of these age-old customs have so much science behind them, but we've just debunked those as myths. And truly, I think if we dig deeper, there's probably more insightful reasons as to why those practices were followed. Now, I know that we are almost out of time today, but I do want you to talk a little bit about what can postpartum women actually do, because what are we going? I know that I struggled. I was waking up every 2 hours in the first month because my son would never be able to sleep longer than that. And what are we to do? I mean, obviously, in my case, I didn't have people around to help, and my husband had to go to work. So the only way to out of that was to tell him that please go sleep in another room and get to work. But because of that, it took a toll on my health because I was constantly waking up. So maybe if you could just provide some insight into what can postpartum women do.
Okay. But what I really feel, recently we're also at RPS, we are conducting a research on these postpartum women. And what we are trying to do for them is, as a part of it, we are trying to introduce Yog Nidra to them. So still the work is not complete, still a work under progress. But what I feel from preliminary results, as I find, it's we have to give them ways and means how they can really compensate for the kind of sleep loss that they'll be incurring in the night. So measures like Yog Nidra could be one thing which could be tried on them. Again, behavior therapy is something that, cognitive behavior therapy it's just to keep themselves away from any kind of negativities which arise as a result of such a massive sleep loss that they have to undergo. Then family counseling, yes, because that's very important. That is a support network that they have, their first family members, their spouses, and even the caretakers, and they can even help, the family can help them take turns, that maybe the women should be given adequate rest, and they should whatever ways and means we can help them, and maybe through methods like Yoga Nidra or a bit of counseling, because the child will anyways need the mother time and again, which we can't avoid those things from happening. But still, it's a research under progress for me also. So let's see what results I get. Preliminary results are good, so we feel that Yoga Nidra or things like that can help postpartum mothers. But I'll be able to comment on it a little later, maybe a few months from now, when I have a large amount of data with me. So
Lovely.
Other ways, not much research has taken place in this area. It's still something which is raw, and scientific community has to look into it.
And speaking about Yoga Nidra, anyway, our listeners can find loads of guided relaxation on the podcast. We have so many by my husband and me, and then they can just play them. But thank you, Shweta. I know we've taken a lot of time, but they were lovely. I love this conversation with you, even though there were areas that we had different views. It was a great conversation. Thank you for giving your time. And I hope at some point you can come back and we can have other conversations which are as insightful as it was today.
Thank you so much for inviting me. It was a pleasure to me, and it was a privilege that I'll be able to address a lot of audience through your podcast, and maybe we can really debunk some myths with our conversation today. That was the purpose behind this conversation, and hopefully to be solved. So thank you, Deepa. Thanks again for inviting me to this conversation.
On today's episode, Dr. Kanchan went through more myth debunking from the world of sleep. Napping is something that I take a lot of care to address in clients. I mentioned Rujuta Devekar, who swears by the afternoon nap. However, in ancient Indian customs of Ayurveda and yoga, daytime napping is considered disruptive to body rhythms. Ayurveda is truly the original circadian medicine, which brings immense attention to how these rhythms, in sync with nature's diurnal rhythms of light and darkness, play a key role in health and healing. Napping is said to increase tamas, the energy of lethargy, and impact optimal functioning of the liver. It is considered therapeutic when you are unwell or if someone is a child or elderly. If you are struggling with symptoms and you need the nap, do nap sitting upright on a lounger. When you start doing better, gently let it go. Have a wonderful day. Hi everyone, I hope you enjoyed the show today. Just a reminder that this podcast is for information purposes only. It is not a substitute for professional care by a doctor or otherwise qualified health professional. This information is provided on the understanding that it does not constitute medical or other professional advice or services. If you are looking for personal help on your health journey, do seek out a qualified professional. Please do make your own healthcare decisions based upon your research and in partnership with a qualified healthcare professional. It is in no way intended as medical advice or a treatment or cure for any condition. Be sure to always directly work with a qualified practitioner before making any changes to your diet or lifestyle that may feel out of your realm of comfort or understanding. If you are looking for an allied functional medicine practitioner, do seek out more information on www.phytothrive.com. It is important that you have someone who is qualified and understands your health personally in order to provide adequate care, especially when it comes to chronic health conditions. Be sure to subscribe to the Sleep Whisperer podcast on your favorite podcast app to get each episode as soon as it launches.